And a man who we also want to know his views on all of this joins us now, Professor Gabriel Scally, public health physician and Professor of Public Health at the University of Bristol. Gabriel, you're very welcome. You heard what we were talking about and you know the situation that we're faced with. The level 5 restrictions have been extended until March. New tighter restrictions on travel and penalties have been brought in. What's your reaction to it all?
Well, it's good to see that there is some movement on borders. You know, Britain and Ireland, across the countries of the world, have been some of the very, very few that haven't really had any meaningful restrictions on travel in and out. And that's a dreadful position to be in when you're trying to cope with one of the most infectious and dangerous diseases we've seen in a century. So I welcome them, but there's no you can't half seal your borders, or you can't half keep the cases out, or you can't half quarantine. So it's a question of how thorough the measures are. For example, I don't believe that it is really possible to determine where someone has traveled from in this day and age. People can travel via all sorts of hubs across the world. They can get to Ireland by boat or by plane. They can change along the way. They can get a plane to Paris, a train to London, and another flight from London, or whatever. So I think the only way to do it is do it properly.
And have we done it properly, Gabriel? Is that what you're saying, that we haven't done it thoroughly enough?
Well, let's wait and see. For example, putting people into hotels to be quarantined is a good idea, I think. An absolutely good idea, because I don't think the self-isolation really works. But you need to manage that isolation. And we know from experience around the world, and that's what we should be doing. We should be learning from places like New Zealand, Australia, Taiwan, and so on. We know that unless you manage that, there will be guests will mix with each other. They will go out. They will mix with the staff. And it doesn't take very long before you can have one of these hotels as a spreading venue.
As a
So,
hub. So just
yeah.
to say, currently the only people who'll be going to hotels are people from certain areas of the world. Regular travellers arriving in will be asked to self-isolate and be legally mandated to, but in their own homes. Is that enough? Should we have every traveller entering the country in a
Oh, I
hotel
think
situation?
absolutely we should. As I say, how do you know where they've come from? I would guess that there'll be very few people who'll be putting their hands up when they're going through the border controls, through passports, saying, "Oh, by the way, I came from Brazil. I might have got off a plane from Stockholm, but that's where I came from." It just won't happen. So it should be the same for everyone. There should be no exceptions. That's the other thing. I really worry about exceptions to it, and people being released early on the basis of tests, which isn't satisfactory either.
The 5 day. This is just for people listening. That somebody could have a negative test on 5 days and exit the self-isolation. You think that
Yeah.
that's not appropriate?
No, it's not appropriate. I mean, if you're going to do it properly, and take your learning from places that do it well, have been successful. But what is interesting, of course, is that the UK is moving fast as well, and we're expecting announcements today about what the UK is doing, and they're likely to put in place tougher restrictions than the Republic. But it's very contentious there as well, so we don't wait and see what comes out. So talk of sealing the
We
border.
mentioned, myself and Shane, the border with
Yeah.
Northern Ireland, something you'd be acutely aware of yourself, obviously. It's very long, it's very torturous. There are multiple, ways to cross it. Is that our Achilles heel? And in fairness to the government, what are they supposed to do about this? We have a political sensitivity, which you're well aware of. We have guards who can't cross into Northern Ireland. We have the PSNI who can't cross into the south. What do we actually do?
Well, there needs to be a discussion, doesn't there, between the politicians, and I've been extraordinarily disappointed at their inability to do anything. We have a memorandum of understanding with Northern Ireland in terms of COVID-19, which promises harmonisation, cooperation, and so on. And we've seen almost nothing as a result. Different rules and regulations in the two parts of the island, and the politicians need to sit down and sort it out, And the spats over the last week between politicians, north and south, about passage of information from locator forms, about whether or not the north is testing for the variant, are all extraordinarily unhelpful and, I mean, shocking. that
So you think that there's bickering largely
oh,
going on?
absolutely. I think that's a perfect word for it, bickering. Instead of sitting down and saying, look, we've got a job to do here, let's get on, let's do it together. But that's the only way it'll work. But I mean, if the Republic of Ireland has to go ahead and get it down within the Republic's borders, go ahead and do it, and put as
So
much restriction on as you can.
as a
But you
as a
see, let
person
let
from
me just
Northern
make
Ireland,
one.
you would have no problem with us sealing the border.
I'd have no problem, but I was going to say if it's possible, but it's 310 miles, and I've worked on the border
Yes.
as a doctor, and it's not easy at all. But what I was going to say was the public, both north and south, are very much in favour of tighter restrictions on incoming cases, particularly incoming visitors bringing cases in, particularly with the variants coming up. So there's a huge amount of public support for this.
There is.
And one of the problems is that there isn't really talk about a strategy for getting back to normal or whatever, but there isn't a strategy for
Okay.
dealing with COVID. In neither part of the country do I see a proper strategy for sorting out the disease. And it is not just, I heard your discussion earlier talking
Okay.
about this being the latest bauble. No, it's not like that. You have to have a whole range of public health
Yeah.
measures, and they are
Yeah.
additive, and sometimes they're
Not
synergistic.
no
They
no one
multiply each
silver
other.
bullet, many silver bullets. Look, thank you very much for speaking to us this morning.